Good evening. The Department of Health has welcomed the return of Dr Aaron Motsoaledi and Dr Phaahla to its leadership. It is confident that their return will ensure the continuity and stability of key health priorities. Core to its aims is the department's mission to strengthen health system effectiveness, working towards South Africa attaining the target of universal health care coverage, as well as for more on the envisioned future of the South African healthcare sector. We're now joined by Minister of Health, Dr Aaron Motsoaledi, and he now joins us via our video link. Minister, thank you so much for your time this evening here in SABC News. Welcome back to the Health Ministry. And I'm sure when you got the news that you would be making your way back to the healthcare sector, you must have been quite chuffed because it's a position you've held for 2 terms.
Good evening, Mbali. Good evening to the listeners and viewers. Well, indeed, Mbali, I was stunned when I was told that I'm going to be the Minister of Health. It took me back to 2009 when I was informed that I was going to be the Minister of Health. I was stunned at that time. You may remember that there were lots of problems at that time in health, especially with HIV and AIDS annihilating our people, maternal mortality and child mortality very high, general mortality and despondency in the country very high, activists fighting with government, and TAC even going to court to demand ARVs. Now, when I arrived in the department, I got the briefing for the first week, as I did yesterday and today. And I must tell you, at that time, after the briefing, I went to a massage parlor, a place I'd never gone in my life before. I had to go there. And they told me that every muscle in my body is tense in a knot because of the stress of what I was listening to. Now, today and yesterday, I got such briefing, and I'm already starting with a baptism of fire. As you know, there are people who have already taken the national health insurance, the flagship of health reform, to court. And I spent 3 hours today listening to the senior counsels and the lawyers who are going to represent the department.
And Minister, staying with the National Health Insurance, I mean, there are a number of people within the healthcare sector who've also criticized, this reappointment and saying that, of course, you are part of those political leaders who spearheaded the National Health Insurance Fund. At the same time, one would ask, is this your immediate task now that we've seen this being signed into law by the President?
Absolutely, absolutely. And I'm proud that I'm one of those people. Remember, the decision to have national health insurance in the country was taken in a conference of the ruling party in 2007. And 2 years later, I became the minister. And so I was tasked with the job of studying to put the building blocks of national health insurance. And I'm actually very, very proud of that. By 2015, we have already finalized the white paper on national health insurance. After 43 versions, we had to change it 43 times when people were giving inputs, etc. So it was not a very easy job, but in 2015 we completed that. Then the start of the work of drafting a bill started, which bill, as you know, was signed into law last year in 2023 and assigned it to this year by the President on the 15th of May.
And Minister, we know that, of course, one of those priorities, like you've alluded to, the fact that will be the National Health Insurance Fund. But at the same time, I mean, you've been at the helm of this department for 2 terms. I mean, you make your return now during a very crucial time in the country. One would also ask, when it comes to other key priorities, what do you anticipate, you will be focusing on during your tenure in the Ministry of Health?
Fortunately, priorities of health in Bali are not to be guessed by anybody. The World Health Organization long ago has already defined the 6 pillars of a healthcare system anywhere in the world, not only in South Africa. So every Minister of Health has to follow that template from the World Organization. What are the 6 pillars? Firstly, is leadership and governance. How is the healthcare system led and how is it governed? That is the first pillar. The second pillar is access to essential medicines and other commodities. And I'm sure many people have already spoken about that many times. The third pillar is the health workforce, which we usually refer it as human resources. What is the workforce that you can put in the healthcare system, like soldiers going to war? The fourth pillar is healthcare financing. How is healthcare financed? That is where NHI comes in, actually. And it's a central pillar because nobody can do anything without finance. That's why ministers of finance all over the world in any country become the most senior ministers after the head of, the head of state. Because without that finance, no program will be able to be possible. So that is the fourth pillar. The fifth pillar is health information system. What information systems are you using in your country to map up the identities of people and healthcare and know their ailments and know their files? And the last pillar is health delivery systems. How do you deliver healthcare to various parts of the population? If a woman is pregnant, what is due to that woman? Does anybody know what package will that woman get? If a child is born today, what is the healthcare package of that child? If I get infected with HIV/AIDS, what is my route? That's healthcare delivery system. So those are the pillars of healthcare. What has been missing in South Africa all this time is this fourth pillar. I did not necessarily put them in the order of importance or preference, but today I mentioned healthcare financing as the fourth pillar. That healthcare financing is the pillar that has been evading us and evading many parts of the African continent, which then produces such poor healthcare outcomes.
And, looking at some of the shortcomings from your tenure as the Minister of Health and the previous administration, this time around, what will you be doing differently to ensure that the Health Ministry is effective?
Well, in any portfolio where which one has been through to, you start learning. So it's a learning curve. Every time you learn that maybe I should do things a little bit differently this time. Now, what I can say is that the flagship of the healthcare system is going to be this healthcare financing ban. I am going to sit on that. I have to. I had somebody criticizing that and saying we believe it's a panacea. It is important all over the world that healthcare system be funded equitably, because Mbali, if you want to see the expression of the inequality in South Africa, remember that everybody agrees, especially you guys in the media. You emphasize the fact that we are the most unequal country in the world. If you want to see that inequality come to healthcare, you'll see it alive and kicking in all its manifestations. So NHI is going to be an equalizer between the rich and the poor. What has been happening all the time is that the voices that are heard about NHI are the voices of the rich, the voices of those who are well-to-do, the voices of the middle class, the masses of the people who's at the moment who receive very little from the healthcare system because of the poor financing. The masses of them are quiet. In fact, they end up even rehearsing what the rich are saying because they don't have any voice. Now, this time around, we are going to make sure that the voice of the poor is heard. They understand exactly what the healthcare system is. They understand exactly what healthcare system financing means. They understand that NHI is going to liberate them. It's an equalizer between the rich and the poor.
All right, Minister, thank you so much for your time this evening. That is Dr. Aaron Motsoaledi, the Minister of Health, talking about his return to the Health Ministry. To this now.